Hello everyone. In this video, we are going to see about what is community pharmacy management. Its staff, material coding and stocking, and material management. First of all, staff in a community pharmacy, how the staff has to be maintained, who are taken as a staff in a pharmacy. Pharmacy business is not only trade but also a profession. Yes, pharmacy is not only a business but also it is a profession. As per the Drugs and Cosmetics Act, all the medicines should be dispensed under the supervision of the qualified person. Yes, according to the Cosmetics Act, we have to dispense the drug only under the supervision of the healthcare providers. In India contest, a person passed a 2-year diploma in pharmacy (D.Pharm) and undergone practical training for 500 hours in a hospital pharmacy or community pharmacy, or a B.Pharm graduate with 150 hours of practical training is also eligible to register in the State Pharmacy Council as a pharmacist. Only we can apply the pharmacist in a State Pharmacy Council only when we passed the D.Pharm and have an experience of 2 years, and B.Pharm with the experience of 1 year. Only such registered pharmacists are called as qualified persons. Only the persons who are registered in a state pharmacy is considered as a qualified persons. To assist the qualified person in pharmacy operations, individuals with other qualifications such as +2, 10th or degree may be appointed as pharmacy assistants. In a pharmacy, there must be a qualified persons, and also there must be a assistants who are past 10th, 12th. They can be given in a pharmacy as assistants, and they can dispense the drugs only under the qualifications, under the supervision of the qualified person. The patient-focused pharmacy program formed was started in 2008 by Pharmacy Council of India. Then only they started the PharmD. PharmD was started by the Pharmacy Council of India. PharmD graduates are trained to take the responsibility in managing the overall activities of the pharmacy, including patient-focused services such as patient counseling, health screening services, and drug therapy monitoring. Yes, all the managed activities are handled under the supervision of the pharmacy person, like patient counseling. Patient counseling activity is mainly managed by the pharmacy person. Health screening services like BP checking, cholesterol checking, these are also supervised by the pharmacy. And drug therapy monitoring, all are controlled by the pharmacy person. Pharmacy graduates will really add value to the pharmacy through patient care services. Yes, they will add value to the pharmacy by patient counseling. Patient counseling plays a major role in the pharmacy. Patient counseling means there are 3 main types of counseling: drug-based, disease-based, and condition diet-based counseling. This was given by the pharmacy qualified person. By giving patient counseling, we can promote the pharmacy. Next one is materials coding and stocking. When medicines are received from the supplier, that is wholesale, the stocks should be properly arranged in the racks for easy location and removal of the drug from its carton box at the time of dispensing. Yes, once we bought some stock from the wholesale, means we have to arrange that in a proper place, so that only we can easily identify where the product is, and we can easily check and dispense the correct product without any medication error. Various methods are adapted by the pharmacist as per the choice and convenience, such as company-wise, product-wise, pharmacological category-wise, etc. Yes, we can arrange the products based upon the company-wise, brand-wise, we can arrange the product, or generic name-wise, we can arrange the product, or their pharmacological action, like diabetic drugs are arranged in one track. Hypertensive drugs are on another drug. In this way also we can arrange based on the convenience, our convenience of dispensing the drug. There are three types of classification: mnemonic method, scientific and random method. First one is mnemonic method. Mnemonic method means memory. In order to remember easily the location of the particular category of the medicines, as suitable code may be used, such as GA for all categories of the drugs that are used to treat gastrointestinal disorders. On the top of the medicine cabinet, a label can be fixed stating GA. In this mnemonic method means it mainly denotes the memory. Memory means we have to remember and keep the products, like this can be done only by a qualified person only, because they only know that GA drugs means it belongs to, we can simply put a symbol like a GA in a box. It will denote gastrointestinal drugs. All the drugs which are used to treat gastrointestinal disorders are arranged in that box. Next one is scientific method. In the method, scientific method, all the medications may be divided into various categories, such as therapeutic classification. Further divided into we can divide every products in various categories. Like for example, therapeutic classification means we can simply classify drugs as cardiovascular drugs. The drugs under their class may be first we have to take the section like cardiovascular disorder drugs are given separate, are arranged separately. GA drugs are arranged separately. CVS drugs are arranged separately. Under that we have to subclassify. Cardiovascular, there are many diseases like hypertension, coronary artery disease, next MI. These are several categories of the cardiovascular diseases. In that further it is classified as the drugs which are used in hypertension, the drugs which are used in coronary artery are given in a separate box. Further, all the drugs used for the treat hypertension. Then also we have to classify that hypertension. In that there will be several drugs: diuretics, beta blockers, calcium channel. Based on this, we have to further classify the drugs. Then we can give code diuretics like that. DU. Scientific method means further classification. Like in a rack, we can arrange all the cardiovascular drugs. In that they are subdivided into one row is for hypertension, one row is for coronary artery disease, one row is for myocardial infarction. In that also we have to separately arrange diuretic class, then beta blockers class, calcium channel blockers class, so that we can easily identify the drugs. Next one, random method. Random method means we can randomly arrange the medicines based upon the alphabetical order. This is mostly most of the pharmacy will maintain this kinds of arrangement only. Alphabetical order. A classification drugs are arranged in one track. B categories are arranged in another drug. In this way only these drugs are arranged. Various healthcare items are sold in the pharmacy, such as prescription medicines, OTC medicines, and other healthcare surgical items. Also, not only in the medicines, OTC medicines also prescription, not only the prescription medicines, OTC medicines also dispensed, OTC medications, then surgical items, all the drugs are dispensed in a pharmacy. It is very difficult to remember the location of the item before they are sold. Yes, we don't know, right? If there is no identification means any code word means we don't know where we have arranged that drugs and thus in order to remember their location coding also may adapted keeping the type of item, supplier wise or combined wise. Yes, we can also categorize such items in a supplier wise or combined ways. All medicines received from the stockist should be taken into the central store. Yes, from various wholesale store we have to take all the items to a central store. From there the stocks may be taken into the pharmacy. From there only we will take that items into the pharmacy in small quantities where they may be dispensed. This act will help the retailer in assessing inventory needs. This is random method. Next one is material management. Material management is a basic function of the business that adds value directly to the product itself. Material management is the planning, directing, controlling, and coordinating the activities concerned with the material and inventory requirements from the point of their inception to their introduction into the farm manufacturing process. Material management means we have to plan what are the materials we need in the pharmacy. Planning is necessary, directing, next controlling, dispensing, and to coordinating the activities. Two types of material. There are several types. First one is stocking. Stocking, the drug store should have adequate space for the storage of the drug with proper lighting, ventilation, temperature control. Yes, drugstore, the pharmacy must have a storage facility, stocking facility, where it must have a proper lighting, ventilation, and temperature control. Special locked storage space provided to meet the legal requirements for storage of the narcotic, alcohol, and prescribed drugs. There must be a separate storage for alcoholic drugs, prescribed drugs, and narcotic drugs. The drugs are stored in such a way that they should not be damaged due to high temperature. It is fact that more than 70% of the capital of an enterprise is invested in stores. Yes, the storage must have more facilities compared to pharmacy. Pharmacy storage need more facilities because the storage we will store the items, all the pharmacy items in the storage only for several months, several years. So it should not be damaged. The product should not get damaged due to any improprieties in the storage area, like temperature control. There is no temperature control means the all the drugs which was in the storage area will get damaged. So that should be properly maintained, right? So next, um, so the pharmacist must invest 70% of the investment in the storage area. Objectives of the storage stocking is location of the item in the store. The stocking area, in the stocking area also we have to we must easily identify the items, right? So that it also stored properly, like coding also we can use proper identification of the item, efficient utilization of the space. Functions of the stocking area is we have to receive the item, handle and speedy issue of the material. Next, custodian of goods in store against damage and pilferage, physical stalking and checking. We have to physically stock the items and check it to provide services to the organization in most economic way. Proper identification and easy location of the items. Next one, arrangement of the drugs in drugstore. The drugs may be arranged in the following manner. According to them, we can arrange the drugs in the storage area also in a separate way. So only we can easily identify the items where we have stored it. The drug, we can arrange the drug according to the manufacturer. Drugs are arranged in a drugstore manufacturer wise. For example, the drug manufactured by Glazo, India, are placed in one cupboard and so on. Yes, India, which are manufactured in Glazo, India, combined which we can arrange the drugs which was bought from the manufacturer. According to the pharmacological action, yes, we can place the drug according to the pharmacological actions, like all analgesic drugs are kept in one rack and hypertensive drugs are kept in one rack, and hypertensive drugs anti-diabetic. This way we can, based on the pharmacological action also, we can store each items in a separate cupboard. Next, alphabetical order. Yes, we can also randomly arrange that drugs based on the alphabetical order. A drugs are placed in one cupboard, B drugs are placed in another cupboard, likewise. Next, as per the old stock and date of expiry. Yes, old stock are expiry drugs are arranged in the front area. Next, the stock which have more years is left, means we can keep those drugs in the back area, so that only we will easily dispense the or use the drugs which are going to expire, which are old stock. Next, location of stores for stocking. The location of the stores in an enterprise should be at a place where handling, transportation, and movement of the material is at minimum level. Yes, the store location must be in minimum level, like handling, transportation, movement must be in a minimum level. If there is only single plant or many plants situated at the same area, then it is profitable to have one centralized store to serve all production operations. If there is more pharmacy, we have a subdivided pharmacy in that area, we can arrange the centralized storage area, so that we can easily store all the products for all the pharmacy in that storage, and we can easily transport it to the pharmacy if we need it. The following are some of the advantages and disadvantages of the centralized storage. Advantages means economic. The money will be less. A reduction in incidental expenses also get reduced. Less storage space also, we have less storage. Less manpower required. Manpower also less only enough. Next, more bargaining power due to buying in bulk. Yes, if we buy it in a bulk, means the cost of the product also reduced. We will get more benefits by dispensing this bulk products. Disadvantages, more materials handling operation. Yes, For separate pharmacy, there will be separate materials for so that handling will be more. The chances of delay are likely to be more. As delay will be because there are more pharmacy, right? For each pharmacy, we have to dispense. So delay. More exposed to loss due to natural calamities like fire, rain, dust. This will lead to loss of the products. Next, second one is coding. It is the process of assigning a code number or code symbol to a particular method for easy identification. Usually, manufacturers, distributors, and wholesalers have large merchandise in the store. It is difficult to locate the items in the store. Yes, coding is more important in the storage area because without coding we can't easily find the product where we have stored, so that the coding is more necessary because to find the item easily without any difficulties. Method of codification. The various methods of codification are alphabetical order method. Alphabetical order method means this method we can use letter like C will denotes the capsules. Capsule items are stored in the C section. Next, T. T represents the tablets. Tablet items are stored in the T section. I means injections. Injections are stored in the I section. Next, syrups. Syrups are stored in the S section. Like that, in that way, we can easily store and easily take all the items. Mnemonic method. This method coding letters assigned of each items so that they can be easily identified. For example, APC represents aspirin, paracetamol, and caffeine. Main disadvantage of these items cannot be identified without reference code in textbook. Yes, we can. Mnemonic means I have already told that mnemonic means memory. Memory like APC will there will be a code like APC. APC means there is aspirin drug, paracetamol, and caffeine combination drugs are stored there. Without the book, we can't easily identify. So this is the disadvantage. Next one is numerical method. This method is also known as sequence system method. Under this method, separate numbers are assigned to different classification of store items. The method has the numerical method means number wise. There are several categories. Block system. In this method, the number are reserved for specified items. Example, let the number 10 to 50 is allotted to various types of tablets. 10.1, 10.2, 10.3, 10.4, 10.5 represents antipyretic, analgesic, anti-inflammatory, decongestant, and cold remedies respectively. Like numeric means number wise only. And that block means there will be separate numbers for separate items. 10.1 will denote the antipyretic item. 10.2 denote the analgesic items. 10.3 denote the anti-inflammatory items. 10.4 denote all the decongestant drugs. 10.5 will denote the cold remedies. Like that, there will be separate numbering for separate items. Decimal system. In this system, the number are sent in the digit wise, like 10. Then 10.1 will denote paracetamol, antipyretic. 10.2 means analgesic. Likewise, there will be separate in 10, there will be 10.1. 10.1, all there will be antipyretic, not all the antipyretic, only paracetamol. 10.2 means not all the analgesic, analgin only. Next one is combination method. In this method, both mnemonic and numerical methods are combined to assign a code of different items of the store. Example, code number CPC is allotted from chloramphenicol capsule. Code number PAT11 is allotted for paracetamol with analgin. This method is used when store items are quite large, means we can use this combination method. CPC means all the chloramphenicol capsule item. PAT11 means paracetamol along with analgesic tablets. These are in that compound. Because if there is no large items, means we will have no space for arranging separate items separately, so that we have to combinedly only store that drugs, so that in large drug condition we will use combination method. Next one, locating coding. In large organization, there are large number of stores. The storeroom are divided into blocks, and each block is identified by letter block letter and longitudinal block letter. The location of the items can be identified from warehouse number, block number, row number, rack number, and self number, etc. Like location code means there will be several separate cupboards, separate row, separate shelf, separate rack. Likewise, we will arrange each items in a separate area. Location of any item inside the storeroom can be done in the following manner. How we can locate means, in this condition, fixed location. In this method, each and every group of the item is allotted a fixed place inside the store, according to either supplier wise we can arrange that items, item wise also we can arrange, according to the utility based upon the usage of the items also we can arrange the items. Random location. Next one, this is the most widely used method in almost all kinds of the retail shops, but each group items are stored in a particular cell for its easy location. Yes, random means we can randomly store that each items. Zonal location, according to this system available, space is divided into, we can separately put different zones, then each zone is allotted with the each kind of items, like a bulk zone, reserve stock zone, spare parts zone, consumable items zone. Yes, in this video what we have seen is staff, how we should select the staff in a community pharmacy. There will be farm DD, farm B farm, how much experience we need. Next, there will be a pharmacy assistant, how we can take the pharmacy assistant. And next we have seen the coding methods of coding. Coding will help the easy identification of the item. Next, stocking. Storage area must be more, we must invest more in the storage area than in the other area in the pharmacy. Next is storage, also we should use the coding for easy identification of the item. Next, how we can store based on the coding: alphabetical method, numerical, decimal, block, combination, location, fixed location, random location, zonal location. In this way only we can manage that items in a storage, in a pharmacy and in the storage area. Thank you.